An ectopic pregnancy can take place after a natural conception, which has an incidence of about 1 to 2%, or it can arise following assisted reproductive methods, where the incidence has been noted to be as much as 4 times higher. One of the main factors that can significantly increase the risk of ectopic pregnancy is the tubal factor. If the fallopian tube is damaged by pelvic inflammatory disease or by any kind of previous surgery. Nonetheless, infertility due to tubal factors is one of the most frequent causes for which a couple may decide to seek assisted reproduction in order to try to achieve a successful pregnancy. Thus, it is expected that the rate of ectopic pregnancies with assisted reproductive methods, particularly in IVF, will be higher. In a comparable way, endometriosis has been correlated with a greater risk of ectopic pregnancy, which may be due to the possible presence of endometrial tissue in the fallopian tubes. On the other hand, maternal age over 35 could also increase the possibility of experiencing an ectopic pregnancy. In this case, it is important to mention that the decline in fertility associated with maternal age is considered one of the main reasons for resorting to assisted reproductive techniques. Because all these reasons, there are some people who believe that assisted reproductive techniques do not raise the risk of ectopic pregnancy, but that this risk is actually higher than with natural conception due to the infertility that leads couples to use these techniques. However, despite what I have just mentioned, some factors have been proposed which could increase the risk of an ectopic pregnancy during an in vitro fertilization cycle. Embryo transfer on day 3. When an embryo is transferred on day 3, the amount of time that passes until a possible implantation takes place is longer than when a blastocyst is transferred. As a result, the chances of the embryo arriving at the fallopian tube rise. Transfer of more than one embryo. This might be related to the transfer that occurs on day 3, since it used to be more typical to transfer several embryos at this stage of development. However, currently, there is a tendency to transfer a single embryo at the blastocyst stage. Fresh embryo transfer. The explanation would be that the high hormonal and estrogen levels present during the process of ovarian stimulation may lead to a tubal and uterine environment that could promote an ectopic gestation. In this way, vitrifying the embryos and transferring them at a later date would avoid this negative effect. The same outcome would occur if the treatment involves egg donation. Since the patient does not participate in ovarian stimulation, the likelihood of an ectopic pregnancy would be diminished. Thin endometrium. A reduced endometrial thickness might be associated with an endometrium that is less conducive to implantation. This would encourage the embryo to implant in another location. Alternatively, a properly thickened endometrium might help in preventing ectopic pregnancies. Being aware of all these possible factors may, in a certain way, help to reduce the incidence of ectopic pregnancy that can occur following assisted reproduction techniques.